I've been involved in some teaching sessions with primary care teams, and the whole point of that was really to raise awareness about acute oncology with perhaps healthcare professionals that didn't know a lot about oncology. And so my role has been to develop a teaching package and take it out into the community. The fact that possibly people were being looked after in the community by healthcare professionals that didn't know a lot about oncology has been an issue of safety, and that's been recognised in a number of governmental papers. So yeah, my role's been to sort of take that out there. Many patients, they like to go to the healthcare providers that they know and are familiar with. So they've been going with problems to the GPs or community nurses that they know, Macmillan nurses, district nurses, presenting to them with problems. So, and particularly things that really ought to be dealt with very urgently, things like metastatic spinal cord compression, hypercalcemia, bowel obstruction, and superior vena cava obstruction. So they've been presenting to other healthcare professionals, and it's really to raise awareness of those things that ought to be dealt with urgently, and signposting healthcare professionals to where to get information from and to the right pathways, really, because we've now got a dedicated metastatic spinal cord compression pathway in the Greater Manchester area. So, and we've got an acute oncology management service, which is a telephone advice service, and so we've signposted all the community practitioners that we've spoken to so that they know where to go to get help. Really, it's letting them know that they're not on their own dealing with these patients. Well, I think the problem that we kind of face really is the fact that we're time's limited and resources are limited, and we're only reaching a few. I mean, the project that I've been involved in is a pilot project funded by Macmillan, and hopefully with the results that we've got and the positive feedback that we've got, we might get further funding to take that forward, because we've actually only spoken to healthcare professionals within the Greater Manchester area, but not the extended area that actually we cover the Christie, because they actually treat patients from Cumbria down to Wales, so it's a large area. So the challenges that we face are really how to take that forward and reach a wider audience. We've thought of a couple of things that we possibly could do, and one of them is something very similar to this, in that we might have to use technology to reach a wider audience, maybe in the form of videos, webinars, e-light bites and things like that, with the same information on, the same signposting. And also we need to sort of keep up to date with what primary care providers, the information that they want. So hopefully, yeah, that'll be the way it goes, but the challenge is getting funding for that and time.